Official estimates are that 1.2% of the population suffer from OCD. However, new research released by Benenden Health reveals that more than 40% of people polled believe that they exhibit traits of the mental health illness, highlighting the real lack of understanding many people have of the condition. Now, it can come in many different forms, but how serious is the condition, what can it lead to, and how can it be treated? Well, I'm pleased to say joining us here today to discuss the answers to these questions and more is Beth Murphy, Head of Information from the charity Mind. Beth, thanks so much for coming in and seeing us.
Hi.
Let's talk about OCD. What exactly is it? It comes in many different forms, and what are some of the triggers that could lead somebody to become an OCD sufferer?
Sure, so it has two main parts. The O stands for obsessions, and those are thoughts that come into your mind that you don't want, that are negative. So they might be thinking that you're dirty, that you're contaminated, they might be thinking that somebody in your family is going to die. So really distressing thoughts. They'll cause anxiety, and then as a result of that anxiety, people develop compulsions, which are sort of habits that they repeat time and time again to try and get rid of the thoughts.
Okay.
So that might be, checking a lock, making sure you've turned off the lights, but not just checking it once, checking it 20 times or 30 times, or washing your hands, 30 times or 40 times.
Yeah.
Yeah.
So you've got the thought that you think you're dirty, so you wash your hands 30 or 40 times to make yourself clean, but then that's going to impact on your life.
Absolutely, yeah, and it doesn't necessarily, it may stop the anxiety briefly, but then the thought comes back,
Sure.
so then you have to wash your hands again, and it's a cycle that kind of builds and builds.
And what triggers it? Where does it come from?
We don't entirely know what triggers it, and we don't really know the root causes of lots of mental health problems. For some people, there seem to be some roots connected to, anxiety in childhood, things like that, but for other people, there might not be anything obvious, and they still go on to develop it.
And if you do think, if there are people watching this and they've got family or friends that they're sort of looking at from the outside and thinking, I think they've got something going on there, what can they do? How do they broach the subject, and where can they get help?
Sure. So, the first thing would be to speak to the person, I think. So we'd encourage people to understand more about the condition yourself. So maybe read the information on our website, and then just sit down and try to have an honest conversation. Tell somebody, I'm worried about you. You seem to be acting differently, and then listen to what they tell you as well. Don't assume that you know what's going on for them.
Sure.
But if they do say that there's something that they're worried about, they think there's something wrong, you could encourage them to go and get some help. Possibly from their GP would be a good starting place.
Well, that was going to be my next question. What help is out there, and how seriously is the condition taken by the people that you're going to go and see?
GPs should take it seriously. So if you go and see your GP and they don't, then try and find a different GP. I would suggest try and get a different appointment. You could phone something like the Mind Info line, where we can give you lots of information, and there's also support from voluntary organisations. So there might be a local group in your area where you can meet people who've been through something similar, or you might get some sort of online support as well.
Great stuff. Listen, Beth, thanks ever so much. We only had a little short snippet of information there, but there is lots of information out there, so
Great.
Thank you for coming in.
Thanks very much.
So there we go. Thanks to Beth Murphy there from Mind, and thanks to you for joining us wherever you are, of course. Now, you can find out about OCD in all its forms by logging onto the website, which is allthews.benenden.co.uk/OCD, and you can go to www.mind.org.uk. Thanks for watching. Goodbye.